Hello and welcome to the latest edition of WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. About 1 million Americans are diagnosed with thyroid eye disease each year. Symptoms range from red, irritated eyes to bulging eyes and can lead to a loss of vision. Today we're talking about thyroid eye disease, or TED, with WVU Eye Institute Oculoplastic surgeon Dr. John Nguyen. Welcome, Dr. Nguyen, to Tuesday Talks.
Well, thank you, Mary. It's a pleasure to be here with you today to talk about TED.
It's great to have you here. Okay, so let's start with the basics first. Thyroid eye disease. What exactly is thyroid eye disease?
Well, Mary, before we start, I would say thank you for having me over the studio to talk about these conditions. So thyroid disease is one of a group of eye symptoms that is part of something we typically encounter in the endocrinology office or diagnosis called Graves' disease. So Dr. Graves was the first person to describe all the symptoms that a person typically who have hypothyroidism experience. And thyroid disease are particular symptoms in some patients who may experience eye disease there. And so these, including most commonly you may see with bulging eyes, swelling and redness around the eye, or on the eyeball itself. Some people may experience double vision, and for unfortunate few who may have loss of vision from these conditions.
Okay, wow, that can get pretty serious then. So thyroid, it sounds like thyroid eye disease is actually caused by thyroid disease. Is that it starts with the thyroid, and it's I guess it's kind of, would it almost be a symptom of thyroid disease?
So many times the patients may experience the problem of the eye at the same time as he or she have abnormal thyroid testing. There are times that he or she may have eye problems before they find out or they know about thyroid issues. And that could take up to 18 months or several years before a thyroid issues comes about. Typically, these comes from a autoimmune conditions. In our bodies, we have immunoglobulins that normally protect us from cancer, from infections, but in this particular case, these specific immunoglobulins, they attack the thyroid tissue. And in some people, the immunoglobulin also goes toward the eye socket tissue, these including the muscle that moves your eye, the fat tissue that cushions your eye in the eye socket, or the tear gland, and causing the problems that we have discussed earlier with the bulging eye very commonly in the early phases of this disease, and it can cause severe problems in some patients that definitely would need treatment if it affecting their vision.
So it sounds like maybe you would discover you have thyroid eye disease before you figure out that you have thyroid disease, and vice versa. It could go either way.
That's correct. Many times it's occurred together, but there are a certain percentage of people who have it before.
Okay. So you did mention that thyroid eye disease, or it's also referred to as TED, it could cause a total loss of vision. Is that like if it goes undetected, or is that something that happens very often?
So the answer is not commonly total loss of vision. Only about 5% of patients may be at risk for that. It's sometimes that the patient may not know that it is happening because it can occur rather rapidly or slowly, depend on how quickly the disease onset is. The majority of patients with Graves' disease may notice some changes to their eyes, whether it's dry, irritated eyes, or sensitive to light, being sunlight or glare with headlights, or even sometimes in indoor lights. And sometimes they get misdiagnosed having allergies because eye may be watery and puffiness around the eye. And those are the milder symptoms.
Right.
In people with more moderate or severe, then they may have the protrusion that you may have seen on the internet if you try to search for these conditions. Some people have debilitating double vision, and
wow.
typically the images are one on top of the other one, and it's only swelling, like an allergic reaction, as we talked about earlier there. And those that depend on severity, they can necessitate different type of treatments.
So how do you diagnose thyroid eye disease?
So a diagnosis usually comes about with a complete eye exam. We do testing for the optic nerve, the peripheral visual field, and sometimes we also corroborate with a imaging of the eye socket with a CAT scan or MRI to look for inflammations of the soft tissue, of the muscle, of the fat tissues, or the tear glands that involve. And for patients who we mentioned earlier about losing the visions, we look for whether the swelling compresses on the optic nerve that cause the loss of vision.
Oh, okay. Wow. So if you're diagnosed, once you're diagnosed with thyroid eye disease, how do you treat it? Where do you start?
So once we're diagnosed with thyroid disease, we typically categorize in terms of how severe is the current status of the inflammations is. There's mild, moderate, and severe, and there's a rare percentage of patients who have compressive optic neuropathy, where they have that loss of vision that we mentioned earlier.
Wow.
Certainly, as you can imagine, if somebody who have loss of vision, we would move rather quickly, and typically these would involve strong medications to suppress inflammation, and many times they would need urgent surgery to relieve the pressure on the optic nerve, and usually that's occur fairly rapidly if it's requiring hospitalizations sometimes. There. For the mild, moderate, and severe, usually we would want the patient to be seen by an endocrinologist if he or she has not seen one, because the stabilizations or treatment of the thyroid itself can help decrease of the inflammations around the eye. And on top of that, we would usually recommend comfort measure of lubricating the eyes, ice pack or cold compresses to decrease the swelling, elevation of the head at nighttime, again to reduce the swelling around the eye. And certainly for any discomfort, over-the-counter NSAIDs would help with any pain that they're experiencing. For those that have moderate to severe, we have stronger medications to suppress the inflammation. The medication range anywhere from corticosteroid treatment to the newly approved monoclonal antibody treatment that can help suppress the inflammations there. Depend on the severity, we have follow-up at different time period. It could be as short as every month to several months apart, and it all depends on how much is the inflammations, how the patient progress with all these treatments. The goal here is to monitor for any deteriorations of the vision for which if we need to intervene or escalate the treatment.
So you start with medications first. You're not going to go right to surgery if you have a TED diagnosis, correct? And
Yes, that's correct. Medications always help with suppressing inflammations. We typically reserve surgery for once a patient have gone onto what's called a regression phase, where some people still have residual protrusions of the eye, perhaps some residual double visions, or retraction of the eyelid, for which they still have exposure symptoms where the eye is still dry or irritated. Then we would recommend surgery at that time.
can most cases be treated with just medications, or does it usually go on to surgery?
The majority would find benefits with medications. Small percentage of patients may need surgery.
Okay.
Study have shows that the latest FDA-approved monoclonal antibody treatment does help reduce the swelling around the eye and the double vision as well as the protrusions.
Is that the same monoclonal antibody treatment that's used for COVID? Or is this a different kind of monoclonal antibodies? I'm mixing that up. I'm making it more complicated, huh?
Not at all, not at all. As we can see that, many conditions nowadays, especially autoimmune conditions, are treated specifically targeted by monoclonal antibodies.
Okay.
But the medication for the eye disease, thyroid eye disease, is called teprotumumab. It is a insulin growth factor monoclonal antibody. It targets the receptors in the muscle and the fat and the tear gland tissues in the eye socket, and it does have shown to shrink the inflammations inside the eye.
Wow, it's all about the inflammation, isn't it?
It is. Yeah.
Okay, so what kind of cases determine whether now we've got to do surgery? And is this the oculoplastic surgery we've talked about before?
Great questions. For a patient who did not respond to medical treatment or have inadequate response to medications, then we would typically offer surgery if they wish to proceed further. A lot of times, patients with thyroid disease have quite debilitating quality of life issues. If somebody have double vision, they may not be able to drive. They may not be able to walk up or down stairs. The safety is a major concern, and especially in patients with double vision. Certainly with somebody who have bulging eyes, beyond the cosmetic appearances, it's quite uncomfortable because the eye become painful from the pressure, from the inflammations, but also from the surface being quite dry. So if medication does not help or not enough, we typically offer a team-based approach. At the WVU Eye Institute, we have several specialists that work together. In addition to oculoplastic surgeons, including me and Dr. Bradley Thorough, we have strabismus surgeons who can help with the double vision, realigning the muscle around the eye. We also have neuro-ophthalmologists that can monitor for the optic nerve compression that we talked about before. And sometimes we work with the ENT specialists when we do decompression surgery for the protrusions that we talked about earlier. In any case, it's a team approach. We work together and customize our treatment approach or surgical approach depending on the conditions of the patients and what he or she needs.
It sounds like very highly specialized surgery. Can you talk a little bit about the experience of the staff at the WVU Eye Institute with these kind of procedures?
The specialty that we have at WVU Eye Institute have many years' experience. We have a dedicated thyroid eye disease clinic that have been in existence for over 10 years. We work collaborate closely together, and the patient may be seen by several specialists within one single visit. The visit is often long, but the goal here is to collaborate so that we can deliver a comprehensive treatment plan for the patient. So when he or she leaves the institute, they would know that they're in good hands, that everyone that could be helping them would put their opinions together to deliver that treatment plan for them.
About some of the specific symptoms of thyroid eye disease, like the bulging eyes, I think, is the one that people seem to be most familiar with. Can that go away totally with medication treatment, or does that have to be a surgical procedure to totally go away?
So first and foremost, when you have your thyroid treatment by an endocrinologist, that will help decrease the inflammation around the eye. How much inflammation or reductions of the protrusions of the eye varies in different individuals. There have been individuals who have complete remissions of the protrusions where he or she does not need any additional treatment, even with the monoclonal antibodies. However, many patients have residual or incomplete improvement for which we would offer things such as corticosteroid treatment or the monoclonal antibodies, the tebotubumab that we mentioned, to help further reduce the proptosis or protrusion that we see. With the arrival of this new monoclonal antibody treatment, the number of patients who need surgery have reduced quite drastically. We're quite happy about that because I think it's a approach that is affecting the actual molecular mechanisms of disease. Surgery is a temporizing measure in some sense that it addressing the tissue but not at the fine detail or smaller targets that the monoclonal antibody can attack.
What about if you've reached the point where you lose your vision or part of your vision? Can the vision be restored through surgery or any other treatment?
We have seen cases where patients may come in with severely damaged visions or sometimes almost completely lost vision that have been restored. In the past, typically these have been approached with surgery. We have been able to restore vision in most, if not all, patients with surgery. It is not known at this time if the monoclonal antibody can do that, but certainly that had happened. So we don't want people to lose hope, on if that had happened to them. We're here for your vision, and so we always want to give you a chance.
Great. So can you cure thyroid eye disease through these treatments, or are you basically treating symptoms and just, maintaining the treatment of the symptoms?
So thyroid disease is a autoimmune condition, so for which the antibodies exist within you. We cannot change that. What had happened to the tissue around the eye had often been is the inflammations from this unchecked or unmanaged inflammations. And the exciting part about this is that the monoclonal antibodies has the potential to suppress and also treat the underlying causes. The study have been fairly limited. It's only been approved by the FDA for the past 2 years.
Okay.
We don't know the long-term outcome of this. The several studies have come out and show actual shrinkage of the inflammations or suppressions of inflammations with the monoclonal antibody treatment. So it is an exciting time in terms of there probably will be further other kind of monoclonal antibodies that can help treat this disease. And so I think, within the next several years, we may see that coming, perhaps available for the patients there. There have been few patients who have flare-up, so they may have an episode or over several years they may have significant thyroid disease for which we treat them, and then perhaps 5-10 years later they have another flare-up. It's not common, but it has been seen that you could have relapse of this. And so we always recommend patients to have a close follow-up with either with oculoplastic surgeons or with their eye doctor to monitor for any flare-up that they may see.
Okay. Is there anything we can do to prevent getting thyroid eye disease in the first place?
Unfortunately, there's no, it's still unknown in terms of the triggers to cause somebody to have an activation of this disease.
Okay.
Scientists are working on that. So as of now, we don't know of anything that you could do to prevent that.
Because we don't really know what causes it.
Right. There are, risk factors such as family history
Okay.
In certain part of countries, such as in our area, in the East Coast here, that we see quite a bit of patients. Certainly, as you can tell, we're in a referral center, so we see a lot of thyroid disease patients. But if any patients who have family history of thyroid issues, he or she may want to, just monitor the eye closely to catch any early signs of that.
Okay. So for people that are watching this today about thyroid eye disease, what's the most important thing you want our viewers to know about thyroid eye disease?
I think it's a treatable disease. We have medications, and if you need surgery, we're here to help you. I think the goal of any inflammation or inflammatory disease is to catch it early, because the earlier you can catch the disease, you can suppress that inflammation so that we can get you back to your life, your normal life, before this happened to you. Hopefully we could offer treatment to restore back what the status of your eye, your visions, how you look, relieve any pain, discomfort from the inflammations of thyroid disease.
Okay. So anyone here that's watching and they want to, make an appointment, they want to find out more, what's the best way to make an appointment with the WVU Eye Institute?
Our number at the Institute is 304-598-4820.
Okay.
When you call that number, if you let the caller, the receptionist know that you have issues with thyroid disease or thyroid issues, we will be able to arrange that for you to be seen with our team.
Okay. And we can also go to the website, right? wvumedicine.org/I, right?
That's correct, yes.
Okay. Well, Dr. Nguyen, this has been really interesting. I think we covered a lot of ground. Thank you for joining us today and telling us a little more about thyroid eye disease.
Well, thank you, Mary. It's my pleasure. Anytime.
All right, great. Thank you. Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about thyroid eye disease or oculoplastic surgery, you can always visit wvumedicine.org/I. We'll see you on next Tuesday Talks on February 8th when we'll talk about pediatric neurosurgery. I'm Mary Ravazio Menard, and on behalf of Dr. Nguyen and everyone at WVU Medicine, thanks for joining us and have a great afternoon.